I entered the program when I was at the best health I had ever been at. I was running a lot and weightlifting. My anxiety was really low. I hadn't had about a depression in a long time. I had a really good work-life balance. I felt like it was a good time for me to enter the program and take this on. As the program went through, I felt pieces of that slipping. I felt myself becoming more anxious. I noticed that I was a lot more stressed. I noticed that I wouldn't exercise. I was tired more. I would grab more unhealthy foods. And it became more and more of a cycle. And then I lost a lot of who I was when I entered. And in our program, we talk a lot about self-care, but I felt like it's really hard to implement that when we're so busy and there's so much work to be done. So I was curious if it was me having this issue, if it was a lot of students having this issue, and what that looked like in research. So I decided to take on this question. I felt like the question used the post-positivist paradigm. So because the post-positivist is the belief that there's probable truth, but still objective data findings may be generalizable. So the belief of impossibility of total objectivity. The paradigm relates to my worldview because I believe that self-care experience is a personal experience that requires the person to use their lived experience. So although it can be objectively analyzed through quantifying similarities, people generally have personal lived situations that they use. The theoretical framework that I used for my inquiry was OREM's Universal Self-Care Deficit Nursing Theory from 1971. The grand theory is compiled of three main theories, so self-care, nursing system, and self-care deficit theory. The meta-paradigms that explain OREM's theory of self-care is person, health, nursing, and environment. The meta-paradigm related to the barriers in nursing students' self-care are a person, environment, nursing, and health. But health in this context is relation to the client's health, and thus of little worth in exploring when I'm looking at nursing students' barriers to self-care. So the assumptions I made in my inquiry process were that self-care is positive for spiritual, psychological, and physical well-being. That self-care concept includes performing and maintaining care on one's own behalf to improve and maintain life well-being through agency. Self-care is conditioned by age, development, lived experience, sociocultural norms, and resources such as therapeutic self-care demand, total actions to be performed over a duration of time using methods to meet self-care requisites. So care, I assume that care meant care for others or to care for self. So to care for someone who may not be able to take care of themselves due to age, illness, injury, or temporary condition. Care is also a process of development by caring for others, one's experience of the other person in creating a relationship of connection and trust. So I chose to research using personal knowing because I've gained knowledge of how to search through databases and look through peer-reviewed articles. I knew that I was looking through nursing journals written by nurses for nurses because I was thinking of nursing students' barriers to self-care. So I felt like that was a direct link. So I used my way of unknowing while searching to discover information and data I did not know was out there. Because of what my inquiry question is, I also decided to use storytelling, which is a traditional way of knowing. I also discovered how the ways of knowing are woven within research, providing insight into different perspectives of reality. The evidence that I used was 2 qualitative research studies, 1 descriptive cross-sectional study, 1 pretest post-test single group design study, 1 quantitative study, 1 systematic review, 1 literature review, and 1 editorial. It came to a total of 9 articles. I searched through way more, but these ones seem to have the most information that worked with my question. Where the information came from, I did a North Island College library search through the databases. I used a Google search and searched through Google Scholar. I searched through Cochrane and nursing journal websites to search peer-reviewed nursing research articles. I looked for articles that were within the last 5 years, hoping to find current research. I looked through specific articles by nurses and for nurses that popped up when I did the Google search. The type of evidence used and excluded and what influenced. I excluded articles and information that was for nurses and focused directly on nursing students because I felt like there was a separation between nurses and nursing students' experiences in self-care. I had to alter my search based on the lack of results for specific barriers to self-care. I had a hard time finding a study that was directly looking at the barriers to self-care. They were all about self-care, and then they said what barriers were within that. I included research that stated it was directed towards addressing self-care and searched within these articles to find the barriers. So I included research from outside of Canada to provide a varying perspective on self-care. So my inquiry journey was limited because I had to spend a vast amount of time reading entire articles to find the barriers within them. As I gathered information, I chose to complete my inquiry at 9 articles and an editorial. I had searched through many more to find research, but it became really time consuming. So it was limited because many articles are not current and they're not primary research, and there was no perfect article that I could find that went directly for my question. So what I found that was significant was I had went into this not realizing that I had a personal bias assumption. I assumed that all nursing students had barriers to performing their self-care. I had assumed that everyone was high stressed and that those were the results that I would probably find. However, I found some studies that actually said that the nursing students had very positive self-care habits. They were able to cope with the stress, they had great eating habits, and they had lots of sleep and rest. So I felt like that was really interesting and kind of eye-opening for me. I also found what was really interesting was that some of the research explained how clinical practice settings are unhealthy, and those environments contribute to the stress and anxiety that students feel. Lots of them spoke about nursing students not being able to take breaks to drink water, not taking breaks in general, and how that impacted their health. They also had one article had explained how some nursing students had taken up smoking as a way to make sure they actually had a break, which I felt was really interesting. The main theme that was across most of the research was time. There was a lack of time for nursing students to be able to perform self-care practices due to high amounts of course load. And the course load took up so much time, and then personal life took up so much time, and all of the commitments combined made it very difficult for nurses to be able to perform self-care practices. There was lots of discussion around how nursing students should work with their schools to have it implemented within the curriculum. I mean, I feel like North Island College has it in their curriculum, but I think they were more talking about it being a credit as a homework instead of something that is taught. It's something that is implemented within our curriculum, and I felt like that was really interesting and would help a lot of people. Um, so um, I feel like understanding the barriers to self-care helps nursing students learn to identify and overcome obstacles that are limiting our current practices. It allows nursing students the ability to advocate for change within the healthcare system and their institutions to allow for healthier work environments. I feel that by collaborating with colleagues and faculty, we can gather current research of nursing students who have had positive self-care practices with no barriers and are participating regularly to learn how we can change for the better and implement that within our own practices. And I feel like that will make us healthier future nurses.